The Biden administration has announced the first 10 medications that will be subject to price negotiations under Medicare.
It's a key Democratic priority stemming from last year's Inflation Reduction Act. The list includes diabetes medication, heart medication, drugs for treating Crohn's disease, and drugs for preventing blood clots. Manufacturers will need to decide by October 1st if they want to take part in the program. We're going to bring in Larry Levitt now. He's the Executive Vice President for Health Policy at KFF, a health policy research firm. Okay, can you break down how the whole plan works and who benefits from it?
Sure. Well, the main beneficiary will be the federal government. They will be negotiating lower prices for these drugs, and that means lower costs for Medicare. But Medicare enrollees will benefit as well. I mean, if you use one of these drugs, you'll be paying lower prices when you go to the pharmacy counter. You might have to pay 30% of the cost of one of these drugs. That 30% of a lower price will mean savings. And all Medicare beneficiaries will end up paying lower premiums because if the cost of Medicare goes down, the cost of the premiums that seniors pay goes down as well.
So there are 6 pharmaceutical firms that are currently suing to block this plan. Many Republicans are also against it. What is the pharmaceutical company's argument other than, we would like more money, please?
Yeah, no, they certainly would rather this not happen. And they lobbied furiously against the Inflation Reduction Act when it was debated in Congress. Now they are trying to stop it in the courts. And they have a number of different arguments. They argue it violates their freedom of speech because they're forced to sign an agreement saying they agree to these prices. They argue it takes away their property, their intellectual property, by requiring them to accept lower prices. The important thing to remember is this is voluntary for drug companies.
Mm-hmm.
I mean, yes, if they want to participate in Medicare, they have to accept these lower negotiated prices, but they're not required to sell their drugs.
So given that some of the drugs on the list are made by the companies that are currently suing to stop the plan, do you see them refusing altogether? Or some of them?
I think it's very unlikely that drug companies would refuse to negotiate. Medicare is a big part of their business. They already accept lower prices in every other country in the world. I mean, the U.S. pays the highest prices for these drugs of any country. So I think the drug companies would like higher prices, but they'll be willing to accept the lower rates.
All right, Larry Levitt, thank you so much.
Thank you.